How high-dose vitamin C might support chemotherapy, new findings in pancreatic, ovarian, and lung cancer. As cancer care continues to evolve, there's growing interest in how non-traditional therapies might complement conventional treatment. One of the most widely studied and discussed among these is high-dose intravenous vitamin C, or IVC. While vitamin C is often associated with general wellness, in high pharmacologic doses given intravenously, it behaves very differently in the body, showing potential as a supportive therapy in cancer. Over the past decade, a number of studies have explored how IVC might enhance the effects of chemotherapy and radiation, reduce treatment-related toxicity, and improve patient quality of life. Today, I'll walk you through some of the cancer types where this therapy shows the most promise based on emerging clinical data and real-world integrative oncology experience. An integrative oncologist will have an individualized plan of care specifically for you. IVC will likely be just one of many suggestions. Let's look at the cancer types where high-dose IVC shows the most promise based on current research and clinical experience. Pancreatic cancer, most promising results to date study. A 2023 randomized phase 2 trial at the University of Iowa combined IVC with standard chemo. Results: median overall survival doubled, 8.9 months with just chemo alone, and 16.1 months with chemo plus IVC. Improved progression-free survival and quality of life. No increase in chemo-related toxicity. This trial provides the strongest clinical evidence to date for IVC in cancer, particularly metastatic pancreatic adenocarcinoma. Ovarian cancer study. A phase 1-2 trial at Kansas University Medical Center gave infusions of 75 to 100 grams of IVC with chemotherapy. Results showed reduced toxicity from chemotherapy and better quality of life. A trend toward improved progression-free survival 8.75 months longer in some analyses, especially beneficial for advanced stage epithelial ovarian cancer, where chemo is harsh and patients often suffer from fatigue and inflammation. Colorectal cancer. Multiple lab studies and small trials show that IVC may enhance sensitivity to certain chemotherapy drugs. IVC has shown selective cytotoxicity for KRAS or BRAF mutation in colorectal cancers via oxidative stress mechanisms. Human data is limited but promising in combination settings. IVC may be a useful adjunct for chemo-resistant colorectal cancer, especially those with KRAS-BRAF mutations. Non-small cell lung cancer, NSCLC, IVC is being explored as a radiation sensitizer to improve tumor response to radiotherapy, a chemo adjunct to reduce inflammation and fatigue. A study published in Frontiers in Oncology 2021 reported stabilization of disease in some advanced NSCLC patients, reduced inflammatory markers, and better functional status. Glioblastoma multiforme, GBM, very aggressive brain cancer with poor survival. Early trials at the University of Iowa, phase 1, tested IVC with radiation plus oral chemotherapy. Findings: well tolerated, increased median survival slightly compared to historical controls, reduced fatigue and possibly improved cognitive function. Not curative, but may enhance standard therapy response and reduce treatment-related oxidative stress. Triple-negative breast cancer, TNBC. Preclinical studies show IVC selectively kills TNBC cells via hydrogen peroxide production. Human trials are limited, but case reports in small cohorts suggest improved tolerance to chemo, possible disease stabilization, reduced pain, fatigue, and inflammation. Why it might work: pro-oxidant effect in tumors. At high doses, vitamin C acts as a pro-oxidant, not antioxidant, producing hydrogen peroxide in tumor environments, selectively toxic to cancer cells. Enhances chemotherapy radiation, may increase DNA damage in tumor cells or sensitize them to standard treatments. Reduces inflammation, lowers C-reactive protein, CRP, interleukin-6, IL-6, and tumor necrosis factor alpha, TNFA, all are key markers of inflammation in the body and all linked to tumor progression. Protects normal tissue, reduces oxidative stress in healthy cells, possibly mitigating side effects. Final notes: IVC is not a cure, but it may be a valuable adjunct. It's typically given 2 to 3 times per week at doses of 25 to 100 grams under careful monitoring, especially kidney function and G6PD levels. It's not yet FDA approved as a cancer therapy, but available in integrative oncology clinics. If you or someone you care about is navigating a cancer diagnosis and seeking integrative, evidence-based options that complement conventional treatment, it's essential to work with experienced medical professionals who are well-versed in both the science and safe application of combined therapies. At Find Help for Cancer, our mission is to provide you with clear information so you can make a good decision on your health. It begins with a conversation. No one facility will meet everyone's needs. We are available to answer your questions regarding treatment options, estimated length of stay, and associated costs. When you're ready to take the next step, we will help coordinate a timely consultation with an integrative oncologist to meet your specific needs. Feel free to contact us at 928-546-5963 or visit findhelpforcancer.com. We're here to support you every step of the way. I hope you enjoyed the video. If you're in the need of integrative and holistic treatments for you or your family member, please feel free to reach out to us at findhelpforcancer.com. We'll start with a simple conversation and help point you in the right direction. Happy to help.